Education and healthcare are core institutions in any society. Greece has always had problems in these vital areas. The debt crisis only made them worse. Many parents, students and teachers feel that education must figure highly on politicians' list of priorities, but that it doesn't. There have been harsh cuts in services and salaries. High school teachers Nikos and Maria Katsoulis have 4 children. Nikos says all families with numerous children have great trouble making ends meet. All teachers too, as most of us are part-time. Maria says, I believe that learning in Greece exists based on teachers' goodwill, faith and commitment to change things, and to provide for our children as best we can. Parents do the same. Things are even more difficult for teachers forced to take administrative leave. Nikos a graphic arts teacher, has been eager to get back to work for a year and a half. He says, I've had nowhere to go. I've been staying home, dealing with family, cooking, sending homemade food to my daughter, who's a student in Thessalonica, helping my son, so that I don't end up on antidepressants, so that I don't feel useless, so that I don't feel I wasn't doing my job well. In Nikos' own words, what Greek education lacks is vision. Vision needs to be backed by money. Dimitris is well aware. He's a university student of the austerity memorandum generation, as he calls it, demanding substantial help from the next government. He says we expect generous funding. Among all the member states of the EU and the Eurozone, Greece spends among the least on education. Greece spends just over 4% of its GDP for education, well below the EU average of over 5%, with raised risks of school dropouts and lower prospects for graduate employment. Where students are vulnerable, other groups are even more vulnerable when it comes to healthcare, where the consequences of the crisis have been heavy for many Greeks, notably the elderly. This pensioner says everything just fell apart. We can't find doctors, medications more expensive, cheaper generic drugs make some people sick. Sometimes people go without bread to be able to afford their medicine. Healthcare spending's been slashed by roughly €1 billion over 3 years to 4.22 billion this year. Millions of Greeks rely on free clinics for care. General practitioner Evangelos Fragoulis says as state-provided healthcare in Greece is linked to one's work status, a massive wave of around 2 million people losing their jobs meant they lost their social security. Another consequence of the crisis is reduced employment security and pay for doctors. Thousands of them have left Greece seeking better prospects abroad. Fragoulis says in the past 6 years, 7,500 doctors from the Athens Medical Council alone have left the country to seek better jobs, mainly in the UK, Scandinavia and Germany. Fears for the once universal welfare system and schooling opportunities in Greece have grown intense as austerity policies have shrunk funding. Our correspondent sums up. Greek voters will go to the polls on Sunday tired and disappointed. Healthcare and education difficulties have made them feel like second-class citizens. They expect the next government to end that feeling with action.